Hello, everybody. We are here in Bahrain today, discussing very important topic related to medical sciences field is about medical tourism, and we are here in a conference organized by the Ministry of Health in Bahrain. We are joined here with a very special person. Uh, Without me telling more about it, let me ask him to discuss more about himself. Assalamu alaikum, sir.
Alaikum salam, Mr. Adil.
How are you?
I'm good. How are you?
First of all, thank you so much for your time to us.
Absolutely, my pleasure.
And please, for our viewers, let us know about your name and what do you do.
So my name is Abdulaziz Alshafai. I am an orthopedic resident, but also I am the operational manager of NS Nabeel Alshafai Neurospine.
So, what does this clinic, do, and how is it like bringing in change in people's life?
So NS Neurospine is a specialized center, outpatient center. It deals with neurology, neurosurgery, and spine issues. Basically, any brain issue when it comes to surgical stuff or even medical things and spine things. So back pain, lower limbs pain, and all of these kinds of things. It's a niche. You will not find a specialized private center in this niche much. It will be more general when you find centers or geared towards cosmetic stuff. Usually, if it's specialized centers. For us, we found this niche, or we use this niche because my brother, who is the CEO, Dr. Nabeel, is a neurosurgeon, and he is very interested and very passionate about neuroscience when it comes to the clinical stuff, and also when it comes to research and education. So NS Neurospine started as a baby project of a larger project, which was called ANA, Alshafai Neurosurgical Academy, having three different lines: education, research, and clinical. The clinical part is NS Neurospine, or it ended up being NS Neurospine. We started in September 2022. And ANA still deals with the research and educational part, meaning courses and workshops for neurosurgeons, for doctors who finish neurosurgery or are training the neurosurgery and want to like fine tune what they're doing when it comes to skills and knowledge.
So, I mean, this is definitely a new thing. You talk about it, not so much niche. Within this niche has been work has been done about it. For our audiences, does this also works about because recent time it has been known that Shartika, people who are going through these kind of things, they actually are now the new researches have been showing on that it is not something like cortex or some these kind of medicines that they were used to have it. It's actually a neuro issue, which people then are now starting to realize it. Does this also brings into the point that with this clinic or this research, uh, people who have gone like had an accident or have actually gone through these certain traumas, they can walk through around it just by managing their neuro management, like neuro ways and management. Tell us more about it.
So basically, the term sciatica, it basically comes from a specific nerve called the sciatic nerve, which goes to the back of the leg and feeds the back of the leg downwards. That's why it's called sciatica. But sciatica as a symptom or as a pain in that nerve can have different causes causing it. It could be a disc, it could be an inflammation in this nerve, could be something other than the disc mechanically pushing this nerve. Even, for example, having a car accident or going through an accident, car or not, just an accident in your spine, there could be some kind of fracture, some kind of movement in the bones pressing on that.
So that even a certain foot not pressed rightly can also bring that nerve disbalance as well.
If there is issue with this nerve, because the nerve does come from the back, if there's issue with this nerve, some movements could trigger that pain. However, another thing that people mix sciatica with is basically back pain or disc. They say, oh, I have back pain, I have a disc, which is not true. Like back pain is different than disc pain or sciatic pain. If you would imagine it, it's like a cable going down your spine. And on each level, there are different holes, windows in each level, and you have nerves coming out. These nerves go to specific areas. If those nerves are pinched, you will have pain, not in your back, wherever that nerve is going. So this is basically sciatic pain. Sciatic pain. Sorry, but Some of it is non-surgical, like the management. It depends on what is the cause. So we deal with that with physiotherapy or rehabilitation. Firstly, by diagnosing, having the proper diagnoses, then you can go for the proper management, which could be physiotherapy and medications for a period of time, not your whole life,
Right.
or surgical. If it's for specific cases, you do need to do surgery.
Which brings us to this point that we mentioned earlier, talked about it, and once it is going for surgical, you guys also bring in something interesting technological thing is 3D printing of the entire inside of the body, and then explaining the patient in a tangible way,
Yeah.
which otherwise cannot be explained and more to us.
Because of this project initially being a part of a academy, so we do have a 3D printer. We used it for research beforehand, and now we are using it for patients to explain their issues. It's for selected cases, advanced cases, or very complex cases where you will need the 3D printed model. It will assist us in planning the surgery,
Right.
but also to explain the patient so they can visualize exactly what is happening.
Right.
It is one of our policies or one of our ways of conducting our work. We want people to understand their conditions. It's not just a business where you would just hear, you do this, we take money and da da da. No, we want the patient to fully understand their condition and truly know what's wrong with them,
Right.
and how we can help them.
Well, here you guys, we've had a very interesting conversation. Obviously, this is a very, very big topic. Started from 10 years ago when Elon Musk started this, mentioning at the earlier phase of this Neuralink. But the research has gone not just a lot, but it has now gone into practical application as well. I hope you enjoyed this conversation. We would definitely be having a further conversation with Mr. Hopefully with Mr. Dr. Your brother.
Yeah,
And,
Dr. Nabeel.
Dr. Nabeel. And yeah, thank you so much, Mr. Aziz.
Pleasure.
Thank you so much, and see you soon.
See you soon.